Hi there. Today we're going to be talking about what to put in your hospital bag.
This is something we talk with all of our clients about because even though we're planning on having a baby born at home and a home birth is the most likely outcome, we want everyone to be prepared for transport so that if we had to change plans and go to the hospital, it's one bag to grab. You don't have to think about what to put in it because you've already taken care of it. And so we're going to give you guys some tips on what to have put away.
So the first thing to think about is that if you're going to the hospital, you are probably going to be there at least overnight. So you want to bring everything that you need to be comfortable for overnight. So that's any face stuff that you need, your toothbrush, if you want your brush, if you want a pillowcase that you like or a pillow that you really prefer, if you want to bring pajamas or your robe or something that you can be comfortable in, anything that you would pack for a normal overnight, you want to pack for the hospital.
A robe in particular is a really great thing to have because then you can avoid wearing a hospital gown if you're not interested in that. It feels a little less patient-like if you wear something that is yours instead of a starchy hospital gown that's open in the back. And a robe allows it so that providers can still access your belly to listen to your baby. And of course, you can give birth wearing a robe because you don't have pants on. So it's a great thing to have kind of in any situation, but definitely if you're going into the hospital.
Another thing you might want to think about bringing is any snack foods that you really like. Hospitals have varying degrees of good food. Some hospitals have actually pretty nice cafeterias, and other hospitals are, known for hospital food, which can be unappealing. So for many people who are getting an epidural, there's a limitation on what they're able to eat, but not everyone is getting an epidural, and you might be eating throughout labor, and also in the postpartum period, you might want to have snacks on hand. And you might have a really different diet than what the hospital offers. So when you're first getting breastfeeding started after your baby's born, you want to have high caloric density snacks available to you that you like so that you can be eating frequently to make milk for your baby.
This one is simple, but socks and or slippers can be really comforting while you're in the hospital. Most people don't wear shoes once they get into a labor and delivery room, and it can be kind of chilly in there, and it's nice to have something on your feet that's cozy.
Another thing that a lot of people will bring is essential oils or any scents that make them feel at home. Hospital smells tend to be, really sterile. It smells like, maybe some medical memories that you have, or maybe you've had a hard experience at the doctor or at a hospital before. So being able to kind of get rid of those smells in the room to the best of your ability can be really comforting. So people will bring infusers with essential oils, or they'll bring essential oils just to put on a washcloth and waft in front of their nose. Things like lavender, sweet orange, things that are calming and centering and can help you to stay focused on your labor.
You'll want to pack a certain number of electronic things that will help keep you entertained if you're there for a long time and allow for you to communicate with other people. So we recommend packing phone chargers and then maybe considering an iPad or a tablet or something like that, so that if you are in the hospital for an extended period of time, you have a way to watch something that you enjoy or access communicating with other people.
And finally, one of the sweetest things you can bring to the hospital is the outfit that you want to bring your baby home in. So whether you're transporting in labor or if you're having to go in before you're in labor, you're going to have a baby at the hospital and you're going to bring your baby home. So you want to pack hat, booties, an outfit, whatever you really want to put your little one in to transport them home. Of course, when you're in the hospital and when you arrive home, the idea is to be skin to skin and to not have your baby dressed the whole time, but transporting them from hospital to home means getting them dressed, so you want to make sure that you're prepared for that.